The transformation of modern medicine, profit, power, and the loss of holistic healing. Modern medicine, with its technological marvels, often seems disconnected from simple practices that could dramatically improve public health, such as nutrition, stress management, preventative care, and lifestyle changes. This disconnect is rooted in a historical transformation that reshaped medical education and practice in the early 20th century. I am Dr. Paul Stoller, and this video explores how conventional medicine evolved into a profit machine for Big Pharma, and how we might create a new paradigm not based on profit to provide the care we truly need. At the dawn of the 20th century, the medical landscape in the United States was remarkably diverse. Alongside the now dominant allopathic model, which focuses on diagnosis and treatment primarily through pharmaceuticals and surgery, there thrived a wide variety of schools and traditions: homeopathy, naturopathy, herbalism, eclectic medicine, osteopathy, and others. These approaches often emphasized the body's natural healing capacities, the importance of the environment and lifestyle, and a more holistic view of health. The Flexner Report's publication in 1910 dramatically altered the landscape of medicine. Commissioned by the Carnegie Foundation and influenced by the Rockefeller Foundation, the report, authored by Abraham Flexner, evaluated medical education in North America. While it rightly criticized substandard institutions, it delegitimized traditions of medicine that didn't align with the pharmaceutical model. Schools focused on natural remedies were forced to close or conform to the new standardized model. This transition did not occur in a political vacuum. The Rockefeller Foundation, with its deep ties to the burgeoning pharmaceutical industry, wielded enormous influence over legislators, educational institutions, and public policy. Through strategic funding and advocacy, it promoted a vision of medicine that aligned with industrial interests, one that emphasized patented drugs and standardized treatments over individualized, preventative, and holistic care. As a result, medical schools were restructured, curricula were rewritten, and only those institutions that adhered to the new scientific paradigm received accreditation and funding. The consequences of this transformation are still felt today. The prevailing model of healthcare is largely reactive rather than proactive. It focuses on treating disease after it occurs rather than preventing it in the first place. Chronic conditions, many of which are deeply tied to lifestyle and environmental factors, are often managed with lifelong prescriptions rather than addressed through root cause solutions. This model, often criticized as sick care, has proven highly profitable for pharmaceutical companies and healthcare corporations, but has left many patients feeling disempowered and over-medicated. To be clear, modern medicine has achieved extraordinary things. Antibiotics, surgical innovations, and emergency care have saved countless lives. But it is equally important to acknowledge what has been lost in the process: the emphasis on wellness, prevention, and the body's inherent ability to heal when supported with proper nutrition, rest, movement, and emotional balance. Almost half a century ago, I met Otto Gutentag, the last homeopathic professor at UC San Francisco. When the school converted to the allopathic Rockefeller medical paradigm, it was with the caveat that there would always be a homeopathic professorship at UCSF. He told me he would be the last, and he was. He said the school froze the salary at the 1930s pay level, $8,000 a year, and no one would replace him for that amount. As we look to the future of healthcare, there is a growing call to reintegrate some of the wisdom that was cast aside during the 20th century's medical consolidation. Functional medicine and integrative health are attempting to bridge the gap between modern science and holistic principles. The ultimate goal is to evolve modern medicine to create a healthcare system that values both cutting-edge research and timeless common sense, one that treats not just the symptoms of disease but the whole human being. Thank you for watching this video. The end.